Hello everybody, I am Dr. Tandava Krishnan. I work at Maxivision Eye Care Hospital. I am a vitreoretinal specialist and today I'd be talking about age-related macular degeneration. Age-related macular degeneration, as the name suggests, is an age-related condition which occurs in macula, which is the central part of the retina. Retina is considered to be the screen of the eye, that is, a light which comes from outside focuses on the retina and then the image from the retina is sent through the optic nerve to the brain where the entire information is processed. In age-related macular degeneration, which usually affects people above the age of 50 years, as the name suggests, the macula is affected. The macula is a central part of the retina which helps us in identifying colors and which helps us while we are seeing an object directly. So, age-related macular degeneration is increasingly becoming common, such that in European countries and North America, it is considered to be the most common cause of blindness in people above the age of 60 years. Even in India, it is suggested that 40% of the people have some form of age-related macular degeneration above the age of 60 years. The symptoms which usually present include distortion of the vision or blurring of vision, or the patient might see a black spot in the central part of the visual field. Sometimes the patient might also notice that the colors of objects that they are seeing appear to be blurred. So, what are the risk factors for somebody who is going to develop age-related macular degeneration? As the name suggests, age is a very common risk factor, and people above the age of 50 years are at a greater risk of developing age-related macular degeneration. The other risk factors are smoking, and the less known risk factors include obesity, history of cardiovascular disorders, family history. In terms of gender, women are at a higher risk of developing age-related macular degeneration, and excessive intake of saturated fatty acid also is another risk factor for age-related macular degeneration. Genes also have a small contribution in the causation of age-related macular degeneration. There are two types of age-related macular degeneration, namely the dry and the wet forms. The dry form is more common, such that more than 80% of the patients are having dry form, and it is characterized by the deposition of a yellowish kind of protein called as drusen below the macula, causing the distortion of the vision or the thinning of the retina. The other form is the wet form, wherein an abnormal new vessel is formed below the retina, and this new vessel can result in leakage of fluid or bleeding. The dry form is usually associated with a marginal decrease in vision, and the progression is very slow, while the wet form is associated with a dramatic fall in the vision and the progression is very fast. Whenever a patient comes to us with the probable symptoms of age-related macular degeneration, the patient is subjected to a variety of examination as well as investigations. These include a basic examination of the vision and eye examination, including the dilated fundus examination, wherein a trained retina specialist looks at the central part of the retina called as the macula to identify the various changes that have happened and then basically categorize the severity of the disease. Following this, the patient is subjected to other tests such as OCT, which takes the cross-sectional images of the retina, and it is like a photograph, and fundus fluorescein angiogram, wherein a dye is injected in a patient's hand and a series of photographs are taken to identify how the blood supply is in the central part of the retina and what are the other changes which are happening. Sometimes the patient who are not having severe symptoms can also be monitored at home using a chart called as an Amsler grid chart, which the patient is supposed to be evaluating himself at home at a regular interval, wherein suitable instructions are given as to what to do if the symptoms are varying. Now, based on what the doctor finds, the patient is categorized into dry age-related macular degeneration or the wet age-related macular degeneration. In dry age-related macular degeneration, all that the patient is advised is to use a set of nutritional supplements and home Amsler monitoring and regular eye checkups. In patients who have got wet age-related macular degeneration, there are other forms of treatment such as intravitreal injections, that is injections given inside the eye, and laser or photodynamic therapy. The intravitreal injections are the most common form of treatment for wet age-related macular degeneration at this point in time. Usually, when a patient is found suitable or in need of injections, the patient is advised injections and the injection is given in a sterile environment in the operation theatre. After the injection is given, the patient is a bandage is applied on the injected eye and the patient is asked to go back home, wherein after some time the bandage can be removed. Care must be taken that the no water is applied or water is splashed on the injected eye for at least 3 to 4 days post injection. And some doctors also advise antibiotic drops in the eye which has been injected. Subsequent to injection, the doctor may advise follow-ups in the same week or at the end of 1 month after the injection, wherein the doctor will reassess and compare how the condition has improved or deteriorated subsequent to the injection and take a call whether further injections are needed. The main aim of these injections are to ensure that the disease process stabilizes, and in the worst case scenario, the vision continues to remain the same as what it has been before the injection. In certain situations, the vision can also improve. However, the aim of the injection is not only about improving the vision but also providing an improvement in the quality of the life to the patient, and to this effect it has been proven from various clinical trials that the injection not only improves the vision for the patient but also causes an improvement in the quality of life. The frequency of injection and the subsequent follow-up would be under the discretion of the doctor who is taking care of the patient. But one thing is very clear, that it is not a one-time process, and the patient must commit himself or herself to a long-term follow-up with the doctor and should report to the doctor whenever there is any variation in the symptoms. Other forms of treatment include photodynamic therapy, which is used in certain recalcitrant cases of age-related macular degeneration, or in a subtype of age-related macular degeneration called as polypoidal choroidal vasculopathy. So at the end, I would like to give the message that age-related macular degeneration is a disease which is more common in elderly population, and with increase in the longevity, this problem is going to become even bigger, and the best way of early detection and containing of the severity of the problem is by having regular checkups with your eye specialist.